Hi, my name is Daria. I'm an ENT doctor, and today we talk about the most frequently asked question from beginners to an ENT doctors: why I can't equalize. Equalization is a classic struggle for almost every beginner, and today we break it down and see what might going on with your ears. And there is three main group of reasons why you can equalize: medical, anatomical, and technical. And to figure out which one is yours, it's your first step. And let's start with medical reasons. And if you dive when you have any acute condition, cold, allergy, leftover congestion from your last cold, previous barotrauma when your ears or sinuses not yet fully recovered, or maybe muffled ear from a yesterday dive, most likely here what will happen. Around 3 or 4 meters you will stop by pain in your ears or in your sinuses. And it's happened because your eustachian tube and sinuses are swollen due to inflammation or swelling in your nose. And if you force it, you still continue diving, you probably will end up with barotrauma. Because there is important rule in freediving: don't dive if you have any acute condition. Let your symptoms clear first and then continue diving. With chronic condition, it's different story. Chronic issues like deviated septum, nasal polyps, chronic sinusitis, or maybe surgery or trauma of your nose. Symptoms usually mild, hidden, and often go unnoticed because our body adapts so well. You may start facing problems around your 5th or 6th dive when you begin to have equalization issues, or you reach a point where you can't descend any further, and it's usually caused by eustachian tube dysfunction due to chronic process in your nose. And if you suspect yourself with medical reasons, just visit your ENT doctor for proper diagnosis and treatment. And now we move on to anatomical reasons. When we talk about anatomical reasons, the thing is that all of us are born with different natural abilities, and some people simply have narrow or stiff eustachian tubes, and on land things may work fine and they live without complaints, but underwater, when there is added pressure, they start struggle with equalization. But it doesn't mean that you're not suited for free diving. Our body is amazing at adapting and changing, and eustachian tube daily exercise is a key. There are many videos on YouTube about dry equalization techniques that you can check out, and they really work. Just be patient, it takes time. And if you suspect yourself with narrow eustachian tubes, I really recommend watching this video when I talk about eustachian tubes in details, because it's easy to control something that we really know. Another common anatomical reason is poorly trained or low control of soft palate and tongue muscles, or weak soft palate muscles, which often happen in people with a history of snoring. The common problem of these people is difficulty equalizing in upside down position. When you upside down, your soft palate is stick to the back of your throat and block the airflow from your throat to your eustachian tubes. But this problem is fixable because our soft palate is under voluntary control, and you can train your soft palate muscles and learn to control them consciously. And now we talk about technical reasons. It is about mistakes that you make while you equalizing underwater, the ones that lead to blockage or spasm of your eustachian tubes. And mistake number 1, too forceful equalization. It's really common in beginners. When you ask them how you equalize, they do something like this, like I call it angry blow, and if you look inside the ear in this moment, you will see the really bulging eardrum that almost struggle not to tear apart. The problem is if you keep doing like this underwater, when the pressure increases, it's kind of you bullying your eustachian tube and you bullying your ears. And after a while, your eustachian tubes just can shut down and protest and refuse to open again, because this kind of equalization causes micro injuries of your ears and your eustachian tubes. That's why Valsalva technique is not really suitable for freediving. It's clumsy and it's not gentle. And it's important to learn advanced technique from beginning because they are more softer and more safer for your ears. Mistake number 2, equalize too late or miss your equalization. Our ear is working like this. When the pressure inside the middle ear reaches the critical level, the pressure difference can just literally shut your eustachian tube and it will not open again. That's why it's such important to equalize before any pressure, pain, or muffled sensation in your ears. Mistake number 3, when you overextend your neck or tense up your neck muscles. The thing is, our neck muscles, throat, soft palate, and tongue muscles are teammate. And when one of them is tightens, other will follow and will make your equalization more complicated and harder to achieve. So now let's summarize. If you have a medical reason, visit your ENT doctor for proper diagnosis and treatment. If you have anatomical reason, just start your daily eustachian tube and soft palate control exercises and don't give up, everything needs time. If you find yourself with technical reasons, just remember about golden rule. Equalize early, equalize often, never force your equalization, always check that both of your ears are equalized, and don't overextend your neck. Don't forget to subscribe, give a like, and see you next time.